come to order. A quorum is present. Members, we have a number of bills that are here under Joint Rule 2.03, late bills. Just as a reminder, we're working on these bills not on their merits, but why they're late. And so as we move forward, I'm going to skip to Senator Rosen's bill, Senate File 1712. I'll do that one first and then go back to the beginning. She has another something else she has to do right after. And so this one was ruled on, came to rules under Joint Rule 2.03 as a late bill. Senator Rosen, this is your pension bill. Can you tell us briefly why it's late and why it should move forward?
Well, thank you, Mr. Chair and members. The Senate File 1712 is the Omnibus Pension and Retirement Bill. And we just passed it out of the Pension Commission last Tuesday night with the help of Senator France here on the committee. And I'm not sure if anybody else is on, but it's a very good pension bill. There is no money that has been exchanged. We dealt with several things briefly: the MSRS unclassified plan, the MSRS judges plan, the fire state aid to local municipalities. We allowed St. Paul teachers to be in line with TRA in their COLA, some individual issues, the state auditor technical bill, and a working group created for the 911 and the firefighter supplemental aid. So it was, we had 6 meetings throughout the year, and we just got this all together last Tuesday. So that's why it's late to the rules, or to going to the floor, Mr. Chair.
Thank you, Senator Rosen. Members, any questions on this one?
Mr. Chair.
Senator France.
Thank you, Mr. Chair, and thank you, Senator Rosen. I'd encourage members to allow this to go to the floor. There were a lot of long pension meetings that we put in. We meet Tuesday nights, as members know, and the fact that it's late is no reflection on this particular rule. So I just encourage us moving it along. Thank you, Mr. Chair.
All right. Thank you, members. Okay, with that, Senator Miller offers the motion that the previous committee report from the Committee on State Government, Finance and Policy and Elections be adopted. That report being Senate File 1712 as amended to pass. So you can mute your mics. All those in favor say aye.
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 Opposed, same sign. The motion is adopted. Thank you, Senator Rosen.
Thank you very much, Mr. Chair and members. Thank you, Senator Benson.
Okay, let's go to Senator Benson, Senate File 1589. This is Senator Benson's bill. It was heard in HHS, and she would like to see it continue on its path and be re-referred to civil law and data practice policies. Senator Benson, welcome. Can you tell us briefly why your bill is late and why it should be allowed to proceed on its path?
Thank you, Mr. Chair. It was introduced in time to have a hearing in the Health and Human Services Committee, but because of deadlines was not able to be heard in civil law in a timely manner. And as the conversation about vaccinations emerges, I think it's an important policy debate worthy of review in the Civil Law Committee.
Members, I'm looking for questions. All right. Seeing none. All right.
Mr. Chair, I believe Senator Marty has raised his hand.
Okay, I'm sorry, Senator Marty. Go ahead.
And Mr. Chair, I understand with late bills, I have some real concerns about this. I think the health department would be stymied in its work on a lot of vaccines. I mean, like, for instance, the 90-day limit on contact tracing, I think would hurt a lot of things like what they've been doing with hepatitis, where they often go back far longer than that. So I think it has big implications and so on, and I'm very concerned about it, but I understand the move to civil law.
Okay. All right. With that, Senator Weber, we offer the motion that Joint Rule 2.03 be suspended for all further proceedings on Senate File 1589, and that the previous committee report from the Committee on Health and Human Services, Finance and Policy be adopted. That report being that the bill, when amended, do pass and be re-referred to the Committee on Civil Law and Data Practices.
So moved.
Members, all those in favor say aye.
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 Opposed, same sign. The motion is adopted. Thank you, Senator Benson.
Thank you, Mr. Chair.
Okay, let's move to Senator Kiffmeyer's Senate File 1715. This bill came out of state government and is Senator Kiffmeyer's bill. Senator Kiffmeyer, welcome to the committee. Please tell us why your bill is late and why it should proceed.
Thank you, Mr. Chair and members. I appreciate your hearing. Senate File 1715. Redistricting overall has been late this year. The whole process is delayed. The data is delayed. And we also decided, though, to go ahead and hear this particular bill and keep it moving forward so that it gets into the redistricting committee proper, where it can have a more extensive discussion.
This is an important issue for all of us, obviously. Members, any questions? Okay, I don't see any. So Senator Johnson offers the motion that Joint Rule 2.03 be suspended for all further proceedings on Senate File 1715, and that the previous committee report on the Committee on State Government, Finance and Policy and Elections be adopted. That report being the bill as amended do pass and be referred to the Committee on Redistricting. Members, all in favor? Thank you. All in favor say aye.
Aye.
Opposed, same sign. The motion's adopted. Thank you, Senator Kiffmeyer. All right, Senator Isaacson. 23 Senate File 2308 was referred to the rules on Joint Rule 2.03 as a late bill. This is Senator Isaac's bill and is another redistricting bill. Senator Isaacson, welcome to the committee.
Thank you. It's my first time in front of rules. I appreciate your time this morning.
Yeah, go ahead and tell us why it's late and why you think it should continue on its path.
Everything Senator Kiffmeyer just said was exactly what I was going to say. So, and it's a part of the bigger discussion that we discussed in state and local government. It was good, and I'm looking forward to continuing that discussion in redistricting. I
agree. So, Senator Johnson, will you make the motion again that under Joint Rule 2.03 be suspended for all further proceedings on Senate File 2308, and that the previous committee report from the Committee on State Government, Finance and Policy and Elections be adopted? That report being the bill as amended be re-referred to the Committee on Redistricting without recommendation.
So moved, Mr. Chair.
All right. Any questions? I don't see any. All those in favor say aye.
Aye. Aye.
Opposed, same sign. Motion's adopted. Thank you,
Thank you,
Senator
Mr. Chair.
Isaacson. Just
Thank you.
remember how good we were to you.
It's warming my heart right now. It's wonderful. Thank you.
All right. I think we have one more. Let's see here. Let's see. Did I get them all? Which one am I looking at?
I think you got mine, Mr. Chair.
Okay. There it is. Sorry about that, guys. All right. Senate File 2409 was re-referred to rules under Joint Rule 2.03 as a late districting bill. This is Senator Johnson's bill, another redistricting bill. Senator Johnson, tell us why your bill is late and why it should continue to move forward.
Thank you, Mr. Chair. I can't use the same reasoning that Kiffmeyer and Isaacson used, but it's similar. We got a late bill from the GIS office, which does some language changing for reporting on statutes. So it came late after deadlines. It's a non-controversial technical bill. Senator Isaacson and myself are on that one. So we're just looking to move it forward for tomorrow's committee.
All right, members, any questions? Yeah, this is a really important thing that we're about to do as we try to figure out what the boundaries are going to be 10 years from now. I'm glad we're taking all the different bills into your committee, Senator Johnson. So I will move that, make the motion that the previous report from the Committee on State Government, Finance and Policy and Elections be adopted, that report being, and that the bill do pass. So with that, all those in favor say aye.
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 Opposed? Motion's adopted. With that, members, this concludes the business before us today.
Mr. Chair.
Senator Kent, go ahead.
Thank you, Mr. Chair. I'm wondering if I can just, because we're here together and I have some questions about recent policy changes that affect the Senate. And I'm wondering if I can ask how they fit into the rules process and how the decision-making happens. You made the announcement on the floor on Thursday about a very significant change to our operations on the floor. at our request, you sent out a written description confirming what had been said so that we could review the details of it. We have a Senate COVID preparedness plan that we've been using, and this makes a significant change to that. I'm just wondering, did you work with the bipartisan, nonpartisan COVID working group in developing these new changes? How are these going to be integrated into the COVID preparedness plan that everybody is operating under? How did this decision come about?
Yeah, so I think it was through three or four conversations working with the governor about how do we move through COVID with the fact that now many people are vaccinated. Virtually everybody that wants one over 16 has been able to get one or can get one immediately. And the discussion with some of the health groups that were looking for a compromise to work through how do we move forward from this pandemic. And that compromise is basically what I'm implementing on the Senate floor. That being that if you've been vaccinated, you don't have to wear the mask. We're not going to require proof because we recognize that virtually everybody that wants the vaccine has been vaccinated. And so that's basically where it came from. And then discussions with my team about the implementation and speaking to you on the floor ahead of time about what was going to be happening, and then asking the secretary to put out the guidance based on that direction. But it began with a conversation with some of the health community about how do we acknowledge that the fact is, if you've been vaccinated, the chances of death or serious illness is from COVID is virtually zero, not zero, but virtually zero. And recognizing that if somebody hasn't been vaccinated at this point, it's their choice, frankly. And so that's why. But also acknowledging that I want to accommodate anybody that for whatever reason has concerns, and so we want to let them vote from another room or vote not on the floor or vote even from home. We're still going to allow that if there are some reasons that somebody has a concern. We want to try to work with them as well. But the point is to get to a place where if you've been vaccinated, you should have zero fear of moving forward into living your life as close to normal as you can.
Well, Mr. Chair, after this announcement on Thursday, we did go back and survey our members, and everybody wants to be vaccinated. They have not all been able to be fully vaccinated yet. And I will point to myself, I feel like I managed to get my first shot relatively early given my age and health conditions. And when I was able to get an appointment, I'm not considered fully immune until today. And I know I was earlier than a lot of people in being able to get my first shot. So I don't think I think it is a big leap to assume that people are in fact ready to safely come back on the floor based on their vaccination status. I'm really particularly concerned about staff and younger staff who really don't have a choice. Members do have a choice. You're right. Members have a choice. But a lot of staff does not have a choice. Many of them are younger. And so they would have been further back in the line even than someone like me who's pushing 60. And they have young kids who cannot be vaccinated. And so I know Secretary Ludeman did a really good survey with the COVID working group that he shared the top line results with the rest of us just 45 days ago. And obviously that was still earlier on in the vaccine situation. But he said a couple of things that I want to just remind everybody. He said the power dynamic between senators and staff impedes the ability of staff to request senators to follow social distancing and mask wearing guidelines. I personally think it is important that we each remember that we have an obligation to kind of bend over backwards and make sure that we are not setting expectations of people who do not feel comfortable saying no to us because of our positions. And I would say that there is a particular responsibility on the part of the majority party, the majority caucus, to do that as well. I will also point out in some of his emails, he said, "My hope is that by sharing this information with everyone, all senators and staff will recognize that their actions impact others and that we will therefore see better adherence to the guidelines, even if it is simply out of respect for our colleagues' concerns." And I will just say there are significant concerns. In your letter, excuse me, one second while I find it. At the end, you say, "I am asking staff and members and staff to manage themselves. If you are vaccinated or not, or whether you have health concerns for yourself or a member of your household or family, I am asking you to make the decision that is right for you," which on its face sounds fair, but for members who would like to actively engage on the floor but don't feel safe doing so, we are limiting that aspect of their ability to represent their community. And for staff who may not feel comfortable saying no when they feel, whether explicitly or implicitly, pressured to participate, I think that is something that we need to be incredibly cautious about. And so I just need to raise these concerns here and hope we can encourage members on the floor to wear masks at a minimum, because we don't know who's fully vaccinated or not. We've heard from some members that their views of immunity and the ability to transmit this virus are not what many of us hear from the medical professionals and the scientists. We also know that there are a number of people in the Senate who have said that it's just the flu, and not all of us feel that way. So I would really hope that we can continue, as you have said, to strongly encourage members to wear masks if they are going to be on the floor, adding to the number of people who are breathing and speaking in that space, so that we can stay safe and keep people safe in these remaining days of session.
Well, and this has been the struggle for all of us. I recognize people on both sides of this, without a doubt, have had strong convictions about which way to go. But if somebody has been vaccinated, as my conversation with the governor and talking to some in the health communities who were also talking to the governor, if you've been vaccinated, you do not have to wear a mask, and we're not going to require people to show proof. And I recognize that there may be some people that haven't been vaccinated. I don't know that because we're not asking that question. And that's why I want that flexibility for people. If they feel uncomfortable, I think your case would be that they have not been vaccinated or they don't have antibodies, then we want to make sure they have every opportunity to vote from a different room or to vote from a different location. We're providing that, but we're also encouraging people, as I want the governor to encourage the state. If you've been vaccinated, you should be able to be out there not wearing a mask. And I think, frankly, that if that was an executive order that was lifted, frankly, I think more people would get vaccinated that just want to follow the rules, knowing that if they get vaccinated, they don't have to wear a mask. And so, but without a doubt, there are people on both sides of this issue, which is why I've delayed so long, because I want to truly want to respect the fact that there are people that have different values on this and make sure. But if you've been vaccinated, you are not going to be spreading it. The risk of spreading it is incredibly low, and the risk of getting it is virtually nothing, certainly death. And so that's the good news, and we want to share that good news with people. But we will respect people's decisions not to, for whatever reason, which I'm trying to do with all staff, nonpartisan staff, your staff, and our staff. So I thank you. I thank you for logging that. This has been a very difficult thing for every governor, every state to try to navigate through, and everybody's done it a bit different as we've tried to find our way through. Okay, with that, members, this Committee on Rules and Administration is now adjourned.